All right, terrific. Why don't we get started? I want to first of all welcome you all to this webinar today. I've been waiting for this for weeks. It's just so wonderful to have Dr. Uma with us. It's such an important topic, and to have such a international expert to talk about this area is just very thrilling. I'm Mike Meyer. I'm the co-founder of the Institute for Mental Health Research. I'm the CEO of Meyer Consulting. And I just, again, want to welcome you. This is the fifth webinar in the IMHR series. And I just, it's been exciting to do these during COVID. And I just want everybody to know that we're going to continue these because we've just had such a terrific response to them. Let me now at this point also mention to you that if you want to learn more about the work of IMHR, please go to imhr.org. The Institute's been around for 20 years. We do some remarkable research, and please take some time to take a look at what we're trying to accomplish, because we can certainly use your help. And then lastly, let me turn this program over to Dr. Mitzi Krockover. She is our phenomenal board chair. It was her vision that led to these webinars. She really conceived this notion and has brought this to the fore. She's a partner in SSB Solutions, which is a advisory and private equity firm here in Arizona. Before that, she was very involved with work at UCLA and at Humana. And so with that, I'm going to turn you over to Dr. Krockover.
Thank you, Mike, for that introduction. And I just want to also give a shout out to everybody who worked on this program. We have very dedicated board members and staff, and we couldn't have done any of this without any of them. So thank you. I too am really excited for this webinar. We created, as you know, the series to focus on research-based information that we can use to address the health issues related to the pandemic. And when I actually read about your brain on food, I couldn't think of a more perfect example of the impact of research on mental health. And in this case, focused on the evidence related to diet and food. And not only did I read about the book, I read the book. As you can see, I have taken copious notes as well. So I am thrilled that the author of Your Brain on Food is Dr. Uma Naidoo, also known as Dr. Uma. She is a Harvard-trained psychiatrist, professional chef, and a trained nutritional specialist. Dr. Naidoo founded and directs the first hospital-based nutritional psychiatry service in the United States. She's the director of nutritional and lifestyle psychiatry at Massachusetts General Hospital and director of nutritional psychiatry at MGH Academy, as well as a faculty member at Harvard Medical School. Dr. Uma, we are so grateful to have you with us today. So welcome.
Thank you, Mitzi. It's lovely to be here. Thank you for inviting me.
Absolutely. So a long, long time ago, when I was a medical student, I don't believe there was even a specialty called nutritional psychiatry. So I'm really interested in how you discovered this area and if you could just explain to us or define what nutritional psychiatry is.
Absolutely. And you're absolutely right. Nutritional psychiatry is really the use of healthy whole foods and nutrients to improve mental well-being. It does not exclude the use of prescription medications or other means of therapies. And you're absolutely right about this being a more nascent field. Although the way that I think about it, Mitzi, is that, many of my mentors studied different nutrients and different substances within psychiatry, such as vitamin D, magnesium, omega-3 fatty acids, folate, methylfolate. And what nutritional psychiatry does is brings all of that research together and more to offer more tools in the toolkit for someone struggling with different elements of their mental health. For my own part, it was sort of a long journey, and one inspired by things that I loved to do. And clearly I love food, and that led me to really understanding and wanting to learn more about nutrition. It also goes back to my childhood. I grew up in a very large South Asian family. I skipped out of preschool and wanted to spend the time with my maternal grandmother, to whom my book is dedicated, and the book is called This Is Your Brain on Food. And for some reason, that was more fun to me. And my mother was a medical student herself, and so I spent time with grandma, and she was wonderful. She was a home cook, and I learned simple things like picking vegetables from the garden and helping her prepare a meal. But also, my family was rooted in science, so there were many allopathic medical doctors in the family, as well as a couple of Ayurvedic practitioners. So, my grandparents taught me yoga, an uncle taught me meditation. My grandparents also taught me meditation. So I sort of came into the world with this more holistic view. And when I came to mental health and was learning about psychotropic medications, I understood that as much as they were life-saving, they also had side effects. So I felt there needed to be more tools and there needed to be more questions asked when you start a prescription. And I respected having the power to write a prescription and having the power of a prescription pad, but I did feel that individuals taking medications needed to really have more that they could do for their emotional well-being. And that's really what led me down the different paths of culinary arts, which was my ode to Julia Child. She was my food hero, studying nutrition and really putting it together with my understanding of mental health.
And it's interesting, again, in the many years since I was a medical student, there's been so much more information provided.
Yeah.
I think that's probably something that you're drawing upon. So you talk about, and what we now know is that inflammation is underlying so many of the diseases that we see, both in terms of cardiovascular health and lung and cancer and lung disease. And so you talk a lot about the fact that it also underlies some of the challenges in mental health, and also talk about the gut-brain connection. So could you tell us a little bit more about that specifically?
Absolutely. So, the other thing to help us understand the gut-brain connection, the gut microbiome, is the fact that, if someone went to medical school a few decades ago, this is really was not part of the medical school syllabus. But in fact, the burgeoning research has occurred over probably the last 1 to 2 decades, with, the fact that between 2013 and 2017, approximately, there are about 12,000 journal articles published in this area of research. So it obviously is burgeoning, and I think for mental health is really on the cutting edge of more discoveries that I hope will continue to happen. A patient will roll their eyes if I say to them, but your gut and brain are connected, and why shouldn't they? It doesn't necessarily make sense. But when you think about it and you look at the understanding and go back to embryology, the gut and brain start from the exact same cells in the embryo, then they grow apart, they form the 2 organs, and then they remain connected throughout life by the 10th cranial nerve called the vagus nerve, also called the wandering nerve. And I like to think of that as a two-way messaging system that allows for chemical messages between the gut and the brain and gut 24/7, 365 days a year. And in my book called This is Your Brain on Food, I talk about the gut-brain romance in the first chapter, because it really is like a romance. This gut and brain connection is, there are good days and bad days, and I like people to understand it through the lens of the days that you eat healthier meals are better days for that romance, and the days that you eat less healthy choices, maybe not so great days, because they sort of are dependent on one another. And the food that we eat gets broken down into different substances, and the more positive substances are things like short-chain fatty acids. But when you are tending towards a more fast food diet, junk foods and processed foods, the substances that get broken down, for want of a better word, are more toxic to the gut. And that's where you start to set up for inflammation in that important area within those microbes and in that environment. So understanding that the food we eat actually directly impacts our emotional health becomes important to understand this area, that food is actually a very powerful tool that we can use to our advantage or disadvantage. It's really our choice. But the power is at the end of our fork. And I think that the more we can understand that, the more this becomes something that we can slowly start to incorporate. Because my personal belief is that any step away from the standard American diet is a good step. So if you can make a step towards, one healthy thing that will move from the description of the standard American diet, I think that's a win. And I think that that begins a path of, I think, slow and steady change.
I love that. Power is at the end of your fork. I think that should be a t-shirt or a bumper sticker. And I couldn't not say something about your comment about the amount of research that has been done and conducted in the last few years, and how that has really changed the way that we see the impact of diet. And obviously the Institute for Mental Health Research is all about that. So thank you for highlighting that as well. So given that you talk about the inflammatory response, and you do mention, we're always looking for a quick fix or something that is, one-stop shopping, if you will. And you talk about the Mediterranean diet. And so, and you do speak a little bit about the fact that it's not just the Mediterranean diet, but there are components that anyone can include in their own diet, regardless of your ethnic or cultural proclivities as well. And so can you tell us a little bit about how you might approach or suggest someone to approach this that wants to incorporate those kinds of things, but maybe isn't really connecting with a Mediterranean diet, so that they can treat, any of the mental and emotional challenges that they're feeling?
Absolutely. I like to talk about pillars of nutritional psychiatry, and they may touch on aspects of what's in the Mediterranean eating pattern or diet. But I do think that, what it enhances and what I like about it is it really is full of vegetables, fruit, healthy fats, beans, nuts, seeds, legumes, healthy whole grains, olive oil, and things like seafood and poultry and other things that if a person eats those foods, they can include in their diet. But ways to start, I think, are super simple. I like to think about the following pillars. One is eat whole, be whole. So think about eating an actual piece of food, an actual food, a whole food, rather than something that is processed and put together in a factory or in another way, something that's manufactured. And it's really, eat whole is really being whole. It's approaching good steps away from the standard American diet and towards a healthier lifestyle, because nutrition is really considered a driver in lifestyle medicine, and in my opinion in psychiatry as well, because we can change that. We eat, we have several meals a day probably, and it's very much something within our control. So I think the first one is eat whole, be whole. Another one is the greener the better, because leafy greens are one of the components that are super healthy and super nutritious and nutrient dense for mental well-being. Things like folate and iron that are contained, low folate has been associated with high levels of depression and sometimes loss of brain cells. So just having enough rich folate from those leafy greens, the greener the better, is good for you. So I always like people to build on multiple different types of greens, to change it up and to have that as a base. Again, many of these will go back to elements of what may be in a Mediterranean diet. The third one I like to talk about is really including those prebiotics and fermented foods, because prebiotic foods are simple things like the allium family: garlic, leeks, onions, asparagus, oats, bananas, many different things that I list in my book. But those are foods that, again, will help the gut microbes because they bring back nurturing food for the gut microbes. We'll go back to that in a moment. And then fermented foods, things like kombucha, kefir, miso, tempeh, just to name a few. I'm sure that many people on this call will know others. Bring back great live active cultures and good microbes to the gut environment. So that's another one to think about. So just by starting there, and my other favorite pillar is eat the color of the rainbow. Why? Because the different colors of vegetables, or say something like the anthocyanins and blueberries, bring back rich plant polyphenols, which are rich in antioxidants and anti-inflammatory substances to those gut microbes. Why is that important? Because the gut microbes, there's several different types. And they live down there with many different functions. They help with our immunity. They fend off infections. They help with, they involved in circadian rhythm, hormones, sleep patterns, so many different things, but they're also involved in mental health. So when we are taking care of them and giving them foods that help to nurture them, and fiber is the best way to do that, we get fiber from all of the foods that I just listed, because fiber is found in fruit, vegetables, beans, nuts, seeds, legumes, and healthy whole grains. Again, harkening back to that Mediterranean eating pattern. You don't really get fiber from animal or seafood protein. So many of us in the US think about grams of protein, but actually we're missing the grams of fiber in our diet. And the important thing, a study showed that 1 in 10 Americans eats enough servings of vegetables and fruit a day. So, we're sorely lacking in the fiber department. And I think that where it becomes important in my field of nutritional psychiatry is that fiber becomes the food that is needed for those microbes to thrive. When you're not feeding them fiber, and if you're feeding them junk foods, processed food, fast foods, and all of the stuff we sort of know we should be staying away from, but are now more closely linked to mental well-being and poorer mental health, the bad microbes get fed and they start to really thrive. And when they thrive, they overcome the good microbes. And that's really the basis of setting up for an imbalance or inflammation in the gut.
To your point, I was thinking about how many of us reach for our comfort foods. For me, it's ice cream. For my husband, I'm going to out him, it's meatloaf and potatoes. Those are high in sugar and carbs, which you just talked about. And they obviously can make us feel worse than when we started. So why, I'm just curious, evolutionary, why do we do that? And what can we do when we go to reach for those things? What are some of your suggestions, perhaps to your patients, about how to divert them to something else?
Absolutely. So let's take the examples that you gave me. I think that, I wrote this, it's a media piece on the fact that, what we call comfort foods are discomfort for the brain. And I think that that's probably what we want to think about more carefully over time, because yes, we might feel for something or like the taste of something and reach out for it, but may not be in the long term the best option for us. So if we were to break it down, my suggestions about how to work with evolving these foods that we might reach for is that, our as a chef, I really care about food being tasty. So I wouldn't want you, Mitzi, to have ice cream that you didn't enjoy and wasn't yummy. And one of the recipes I tested in my book was for banana ice cream, which some people call banana and ice cream. So using fruit in a manner to sweeten for a dessert is actually a great way to go, because it really gives you your servings of fruit. And the ice cream can actually be made into a chocolate flavor by adding extra dark cacao powder. And I like the extra dark, more natural raw cacao because it's really rich in cacao flavonols. Again, great for your brain. So there, right there would be a way to think about, the ice cream that you have and maybe making it in a flavor, but using the base of bananas, because you're getting a serving of fruit, you're getting the fiber and vitamins from that. And I don't actually add sugar to it. So it's really up to the individual to use the sweetness and richness of those ripened bananas. Now, if I were to think about what your husband eats, I like people to think about what their favorite food is, and then I like to work with them to tweak it in a better direction. So I might use something, I might use a different type of meat. I might, make sure that I was getting, if it's affordable, a grass-fed type of beef, or, if you want to go in a more lean direction, maybe turkey, but flavor it up. And one of my big tricks with meatloaf, it's actually on its own, it's technically really not unhealthy, right? But what I love to do is finely chop up veggies and include it in the base of the meatloaf, so that when you slice it, you're not seeing a big chunk of carrot, or you're not seeing a big chunk of something, because it's really all cooked in with the onions. And so it depends on what you can do to tweak it. Another favorite with things like meatloaf or those types of dishes is spices. Spices are very powerful for the brain in terms of being rich in antioxidant and anti-inflammatory properties. They can be added into any dish. They're salt-free, calorie-free, and sugar-free. So adding in a more powerful brain nutrient is another good idea. And, turns out that maybe instead of the mashed potatoes, my hack on that would be my neuro hack or chef hack, whichever way you would like to call it, is that what happens when you bake a potato and cool it is that the starch undergoes a process which actually turns it into a resistant starch, which makes it actually a form of fiber for your gut. So instead of the mashed potatoes, maybe have a baked potato. So bake it ahead, allow it to cool, and then reheat it and have it with your dinner or whatever that might be. But that allows the process of retrogradation to happen, and it makes it a more healthy version. So I'm not saying he should eat it every night, but that's another little hack to make what he liked or what he enjoys a healthier version. So I like to do that with any meal that someone comes in. The things that are harder to do are, I can't change a candy bar into a form of food, but I can take a food that you like and try to make it healthier so that you can work to work in a healthier direction if you enjoy the flavor, and you can play with that to the best of your so that they please your taste buds. I think that becomes important, because when people are eating so-called diet food, they can be quite unhappy, and that's works against the purpose of improving mental well-being and mental fitness.
That's really good information. So what you're really saying is you really need to be present, and think about, rather than just, getting something off the shelf or off your refrigerator shelf, and
Right.
also to be intentional. So that's the message that I'm getting from you.
Absolutely, because the point that you're raising is extremely important. When it's easy and convenient and it's in the fridge, we grab it. It does take a step of preparation to plan to make those things, to plan for the alternatives, to plan to have whole foods available. So we don't necessarily go to the alternative, which is convenience, often based on convenience.
So really to have those things ready to go before you need them in the middle of the night, perhaps.
Right, exactly.
And speaking of being intentional, you were very candid in your book, in your introduction, about your cancer diagnosis, and how you really went on a journey with respect to not only diet, but meditation and mindfulness and exercise. And I was curious to know if, I think each of those separately have been shown, and there's research to show that those are very important pieces. Do we know anything about the impact in the aggregate about that kind of a holistic approach to lifestyle?
I think that more and more research is coming out in that area. I can't speak to a specific study off the top of my head, but I do know that a study even published during early COVID showed that, a type of breath yoga, pranayama yoga, helped elements of heart disease, but also helped lower anxiety and depression. So I think that more and more that we are studying these areas, and the more and more that we're studying, say, the gut microbiome or different elements, we are putting together the fact that this becomes a powerful area. And I said in that chapter of my book, or in the introduction, I should say, I spoke about that because the model of care that I practice is holistic, integrated, and functional. I always look for root cause. I integrate the person's care with everything else that they're doing. And I do think that mindfulness, mindful eating, meditation of any form that appeals to you, it works for people. Sleep hygiene, hydration, movement. When someone's severely depressed and they're unable to get out of bed, you cannot talk to them about 150 minutes of exercise a week. You have to help them get to a point where movement becomes more meaningful to them. So it's about meeting the person where they're at, embracing that moment, having awareness. The same thing with something I call body intelligence. People don't often pay attention to how food makes them feel. But when they describe symptoms to me, I will ask them what they've been eating at the prior meal. And so when they're coming with brain fog and exhaustion and needing to lay down after a Zoom call because they're just exhausted in the afternoon, often I'll say, well, what did you eat earlier in the day? Were you drinking enough water? Were you getting up and stretching? Did you spend even 10 minutes outdoors? 10 minutes of outdoor time gives us 80% of our vitamin D requirement for the day. And that vitamin D helps depression and anxiety. So a simple, breath of fresh air for a few minutes between phone calls and Zoom calls becomes important for our mental well-being too.
Thank you. And speaking of brain fog and some of the challenges that I think many of us have experienced, perhaps on a continuum, if you will, there's certainly the challenges and the stresses that we've all dealt with this past year, but also the increasing evidence. And one of the reasons that we started this webinar series was the impact on mental health with respect to COVID, whether or not it was from the situational standpoint or even perhaps the effect of the virus itself on the nervous system. Any information on how, especially the brain fog, especially some of what's called the long haulers have expressed, and all of that, what has been your experience, or has there been any research about that in relationship to diet?
So not in relationship to diet yet, but I think there's so many possibilities of what we can do and can use. What we do know, that's in the research you're referring to, is that individuals who've survived COVID have a very high percentage of experiencing mental health symptoms. And, I think that nutrition and diet becomes so important even in that area because people are suffering more. We know that COVID has had a horrible effect on mental health. And I consider it to be, research has been done calling it the parallel pandemic. I also like to call it the silent pandemic because although we are not unaware of it, I think that we tend to be focused on the parameters around COVID, the actual infection and the disease and the outcomes. But people are also suffering from isolation, from lack of contact. 11% of Americans, per the CDC statistics that were released last summer, thought about suicide. That's a very high number. 20% of teens have thought about suicide. So COVID has really done a number on our mental health. And I think that with knowing from the research that has shown depression, anxiety, insomnia, now called coronasomnia by some, have all increased. People are more traumatized. Use of drugs and alcohol have increased. People may be confined with someone who may be abusing them. So trauma and abuse has been on the rise. So it's been, it's hard to say that anything in mental health has improved with COVID. And I think that that's where awareness and having us really be able to help ourselves and take some steps to improve things would be super important. And nutrition becomes at least a low-hanging fruit, so to speak, where we can start.
That's a really good point. You mentioned about, even children and adolescents being affected. And it dawns on me that this might be a good way to connect with kids and teach them good habits at the same time.
Absolutely.
Thank you for that. I just want to remind folks that we are going to take some Q&A. If they wanted to put your questions in the Q&A, we'll get to those in just a moment, and want to really invite the audience to do so. So you talked a little bit also about alcohol and caffeine, right? And that's another kind of ancillary to the comfort food. We kind of go to those things sometimes just to make things better. Talk to us a little bit about your thoughts on that and some suggestions, if you would.
Absolutely. So, with both caffeine and alcohol, the way that let's take caffeine first. The research has shown that, especially when it comes to anxiety, that consuming less than about 400 milligrams a day is tolerable to most people. So in my book, I just give examples of different types of coffees that people can have for the content. But my general guidance around coffee is that it's a healthy substance on its own. It's often what we add to it when we have it in the day that becomes important. It's also the quality of coffee, and certainly studies have been done around, procuring better, more healthy organic forms of coffee, which I definitely support. But 1 to 2 cups early in the day is okay for most people. Where I find people do get into trouble is they don't pay attention to body intelligence. So they have a cup of coffee, they become jittery, they're uncomfortable, their heart is racing. It's clearly not working for them, and it's worsening the anxiety. So cutting back, going to half calf or decaf over time becomes important. Then another point is having it early in the day. Because after about 12 noon or 2 p.m., it's going to impact your sleep. Maybe switching to a mint tea in the afternoon, or something that is, can give you a little bit of a pick-me-up, maybe through a flavor profile, but rather than the actual caffeine. Then I think the big concern is what people add to it, because if they're adding a lot of processed creamer or a ton of, 8 teaspoons of sugar, something like that, which has happened to me when I evaluated someone, then it becomes a problem, right? This is not so dissimilar with alcohol. If you are, having a cocktail that has simple syrup is sugar. It's 1 part sugar, 1 part water. So, have a cleaner cocktail, have fewer, think about, be mindful of when you have it and how you have it. When I say cleaner cocktail, rather than the simple syrup and multiple liqueurs in it and fruit juice, all of which bring extra empty calories, have a cleaner cocktail and move on, or have a glass of wine that, with the resveratrol and the polyphenols in red wine, there may be a benefit there. But my caution about alcohol are a few things. If it makes you anxious, or if you're drinking a little bit too much and you notice yourself getting up with panic or anxiety, it might be mild physiological withdrawal. But another thing is, if you're leaning on alcohol to help you sleep, it's going to disrupt your sleep architecture over time. So, if you're having a real dinner and you move on and you're sleeping okay, that's different. But I think just, again, having awareness of what we're doing with both alcohol and caffeine, and what we add to it when we have it in the day, and coming back to sort of habit around it.
Thank you. We do have some questions. I'm going to go to those. One of our audience says, I tend to eat well, but I don't like to cook. I typically have fruit or fruit smoothies for breakfast and 1 other meal per day. Do you have any suggestions for easy, healthy, 1-dish meals that don't take a lot of time to prepare? I'm not a big meat eater, so tend to lean toward pasta and vegetables, and I'm afraid that I'm getting too many carbs in my diet.
Mm-hmm. So, carbohydrates on their own are important macronutrients, where we get our carbohydrates from. My suggestion for this individual would be if you tend to be, let's say, more plant-based, then think about sheet pan meals. A simple sheet pan, half sheet pan, using parchment paper, which will help with, things not sticking. And think about the following. If you do eat meat or seafood, you could always say put an omega-3 rich piece of salmon or a piece of poultry on there as well, or more pieces if you're cooking for the whole family. But if you're not, why not do multiple different veggies and roast them with interesting spices and some avocado oil? Not only will that provide several meals for you, you can use the leftovers the next day, you can add them to a salad. And I would go with the sulforaphane-rich vegetables like broccoli, cauliflower, because of the important nutrients in those, asparagus. And then I would throw in, things like chickpeas, a can of organic chickpeas, rinse them out, add them in, add interesting spices, think turmeric, pinch of black pepper, paprika, a little bit of salt, a little pinch of salt, and easy to cook one, in the oven. One step that you need to prepare. You can even buy the vegetables frozen. Vegetables in the US that are frozen are flash frozen at their peak, so they're perfectly fine. If they come with the sauce, the syrup, or added sodium and stuff, then watch out. But generally, frozen vegetables are an easy way to go. So I'd start there with the sheet pan meal.
Thank you. Second question is something that we've all been told, that breakfast is the most important meal of the day. Is that true? also that means that sometimes this individual's first meal is not until noon or even later. So does that even qualify as breakfast?
Right. So it's interesting because the new research around intermittent fasting, there's a great paper published in 2019 in the New England Journal of Medicine that really broke down the important elements to our health and wellness for intermittent fasting, fasting mimicking diets, etc. So there's a lot of good evidence around the fact that people who can fast and who obviously is firstly speaking to their doctors about it first to decide if that's a path for them. It sounds like the individual who asked this question, maybe they're not planning to, but they are sort of fasting without maybe intending to. So it's not that breakfast isn't important. I think so much now, Mitzi, comes down to personalized plans in nutritional psychiatry because our gut microbiome really is like a thumbprint. So the way that I think about it is some of my patients simply aren't hungry in the morning. And so I say to them, well, why not have a nutritious meal at say 10 in the morning or 10:30 when you feel like eating. Make sure that it's a good breakfast and that it's something like a chia pudding, rich in chia seeds, which have fiber and protein, some coconut milk, a rich healthy fat, and maybe some toppings of berries or some healthy nuts. So I'm not suggesting at 10 o'clock they have a sugary donut because that kind of that's not going to help. So might taste good for them at that moment, but it might not help. Oh, so they tell me. So, breakfast is breakfast, right? So we inadvertently, whether we like it or not, for at least 12 hours from our dinner time to the morning, if we eat at 7 or 8, are sort of fasting without really planning it. It's okay to as long as you discuss with your doctor to increase that window. So if you only eat your first meal at 12, it's fine as long as you're feeling okay, you're not feeling jittery because you're experiencing some hypoglycemia, your doctor thinks it's okay, and you're eating a nutritious meal. To me, if you're starting your meals at 12, but you're having a nutritious meal, like a healthy green salad, using the colors of the rainbow, lots of great forms of protein and fiber and healthy fats, great, good for you. So I think it's highly individual. But someone else who feels anxious in the morning, I might actually ask them to have breakfast because sometimes dehydration and just having a low blood sugar can drive anxiety too. So it varies for each person.
You mentioned something about the personalized plan, and there's been some companies out there that say that you can identify your microbiome and your gut health. I'm not sure that we're there yet, and you can maybe talk a little bit about that. But do you see in the near future an opportunity to be able to take a look at your numbers in some way and customize a diet plan for yourself based on, or a food plan, I should say, based on your own gut microbiome?
I think that the research, you're absolutely right, the research is not there yet, but I really hope it heads in that direction because I think that the more we can understand about how to tweak the microbiome by the foods that we eat, the more positive effect it could have for us. So there's this new area on, sort of psychobiotics that is being studied, and I'm hopeful that perhaps over time we will know more about just more about the the microbes in the gut environment. I think that it may be too soon to say that we can fully do everything with the current testing we have, but that doesn't mean that there isn't good information being shared by those tests that we're doing.
Thank you. One of our other audience members asked, what do you think about the stevia or natural sweeteners?
Right. So interestingly, stevia, it is natural and it's generally okay, except has been shown in studies of anxiety to worsen anxiety. So my patients who are coming in with severe anxiety and struggling, I will ask them to be careful about artificial sweeteners. Because for the most part, artificial sweeteners did not show up well in the research around mental health. And I think people should be quite cautious if they're trying to cut back on added and refined sugars and they go towards the sugar-free alternatives or lower sugar alternatives, they might actually be inadvertently consuming a lot of artificial sweeteners.
Thank you. One of our attendees also is asking about the role of vitamin D. About it, we've heard a lot about that in terms of COVID, that low vitamin D levels may have been correlated with worse outcomes. And in addition to that, can you just talk a little bit about when you might want to supplement rather than just get everything from your diet?
Absolutely. So, you know, ideally, we should be able to get things, nutrients from our diet, but in reality, there are many things that affect that, including things like stress, pollution, environment, genetics, so many things, and the actual quality of the food that we might be eating, perhaps by choice, perhaps not by choice, plus the system in which our food is grown and harvested, manufactured, or raised in terms of animal farming. So that brings me to say that in a perfect world, yes, we could get everything and technically could get everything from food, but in reality, that doesn't always happen. So if you're concerned about your vitamin D, have your level checked, have your doctor check your level. Because one of the things we don't want to do with COVID is, you know, over supplement. We want to know where our levels are at and then take the appropriate amount of combination of, you know, vitamin D rich foods and a supplement that your doctor thinks would work for you. And so with supplements in general, I think that check a level, speak to your doctor. There are some good supplements in mental well-being. Vitamin D is one of them. Magnesium is another. Omega-3 fatty acids are another. So there are a few that definitely lean into helping symptoms in mental health. And if you don't consume seafood, there are algal oil or vegan supplements for omega-3s as well.
Great, thank you. One question that I think a lot of us are asking, we, you know, again, going back to the, you know, wanting the one answer, if you will, but what foods would you put at the top of your list? And if someone wanted to really just deal with, you know, any that want to make themselves feel better and happier. And my question was, you know, what's your favorite snack or what's your favorite go-to food?
So, so one of my favorite snacks is actually just two things. I have two favorite snacks. So one is I always have. I like to challenge myself. I like to challenge myself to eat different colored veggies and different interesting veggies. So I will make sure to have celery sticks, but also when I can get kohlrabi, we'll have that in the fridge and slice it up and have something that I can dip into. So that is, I make it a game for myself, so it's more fun. And that is something I love, because then I know I'm getting in some good fiber, but nutrients, and I'm full. If I have, you know, a little bowl full of those types of snacks, I feel better. And my other I have too many, you know, I love food, so how do me stop? I also make my own granola, because I use it as a crunchy topping. I use it as a little 2-ounce quarter-cup snack in the afternoon if I wanted. And I do it with I make it, you know, seed heavy. So add in those flax seeds, hemp seeds, chia seeds, which are all rich in plant based omega-3s, the short chain omega-3s. And then I put in some healthy nuts, raw nuts, and make it on my own, so that I control the flavors that are in there. And it's a snack that I can even when I used to travel and that type of stuff was also a good thing that you can make a batch of and store, and then have snack or topping for your oatmeal or for your chia pudding, anything else during the week. So those are some of my favorite go-to snacks. And I think, you know, in terms of top foods, there are so many that I list on my website and my media articles that I do, my blogs, all of that. But, you know, it's hard to just say it's one food. And the reason is that what I want people to take away from this is it's really a lifestyle change towards healthier nutrition in nutritional psychiatry. I wish I could say it was just turmeric, one of my favorite spices, with a pinch of black pepper, but that will help you. You know, it could also help you to increase, right now today, start increasing the vegetables in your diet, and make those the lower glycemic, high fiber vegetables like cauliflower, broccoli, Brussels sprouts, asparagus, all of those that will just increase your fiber. It could also be eating more fermented foods. You know, it could be leaning into those spices for different flavors. But you know, the good amount of research, omega-3 fatty acids from things like sockeye salmon, sardines, mackerel, but also plant-based sources, like I mentioned. A good amount of evidence for things like turmeric, being rich in antioxidant and anti-inflammatory. Always add a pinch of black pepper to make it more bioavailable to your body, but most importantly, brain. And you know, dark chocolate is a really good a mood booster, because super dark raw natural chocolate, 70% or higher, is actually rich in magnesium, rich in serotonin. It's the way that it's made, it's a prebiotic, so it's super healthy on multiple levels. And it takes, you know, it's a great, if you can get used to it. And you know, if you're used to a candy bar, you might take a little bit of getting used to it, but a lot of people now love dark chocolate. So those are just a few to get you started. But what I want people to understand is, even if you eat salmon every day this week, that doesn't mean that your mood is going to improve. In fact, that will make your diet a little bit imbalanced, because you should be balancing it up with other things. It's including those things and building up slowly towards a better eating plan, and moving away from those processed foods that we're hoping you'll do.
Thank you. And I'm pretty sure that most people are saying, where can I get a Dr. Uma? And, you know, again, I think that as you have noted, that this is a continually dynamic field. And
Yes.
And so how do folks that are listening who want to either learn more or even potentially, you know, consult someone, how could they go about doing that?
So, you know, Mitzi, this is a nascent field, in that individuals like myself really are trying to create more educational opportunities for other clinicians, other practitioners to learn more. At Mass General, through the Academy, we released the first cooking show for mental health professionals in February of this year, a combination of cooking recipes from nutritional psychiatry, which are evidence-based and CME-based questions, but also paired with a colleague who's a family therapist, talking about family dynamics at the dinner table to make food more fun and more interesting to a family. So based on that, I'm actually rolling out more educational programming that will be helpful to really help individuals be able to use these methods in their practice. So practitioners, clinicians, doctors, psychiatrists, or primary care physicians be able to use these methods. So I am sorry to say that there's only one of me, but you know, I'm making every effort on several levels, actually, to bring this more widely into the world, so that people can have access to these types of methods of treatment that are more nascent.
Well, I'm delighted to learn about that, and I will be following up on that, so I can learn. And I will apologize, we're not going to get to all the questions, but perhaps we can collect them, and maybe you might be able to answer them offline as well. But last question, and that is, to your point, not only to spread the information, but I'm assuming that you really also want to see more research in this area so that we have more evidence. What are some of the areas that you hope will be focused on in the very near future?
Absolutely. So, you know, I think one of the things to say is that epidemiological nutritional science research is very difficult to do. And where I hope most of our research will go in the direction is really diving even deeper into the gut microbiome, the microbes, the genetic material, the impact of personalized nutrition in relation to nutritional psychiatry and mental well-being, is my hope for certainly the things that I'm involved in on that. But I also do see it as a frontier that we should be approaching. That doesn't mean to say that I know everything, or that there aren't hundreds of other things we can be doing. But for me, I think that that's where my work has led me. And I would hope that that will provide us more information. I never want to overstate where we're at, but my feeling about is, unless you have a food allergy or intolerance, food is a very easy thing to start to implement to improve your mental well-being. It's really about any one of us being mentally fit these days, and it's not necessarily related to having a diagnosis.
Great. Well, I could talk to you for a long, long time, but we'll have to end it right here. Thank you so much for sharing your time and your wisdom with us. We so much appreciate it.
My pleasure. Thank you, Mitzi.
Of course.
Dr. Uma, thank you so much. Mitzi, thank you. I want to thank all of you for joining us today. I mean, I thought it was just fascinating. Please go to imhr.org if you have a chance and take a look at the work we're doing. Also, these webinars are brought to you for free, as you know, but they do cost us. And all of our funding, about, I would say 95% of it comes from private donors, not from public sources. So please consider making a donation. We also have a wealthy donor who, until the end of this month, is making a dollar-for-dollar match of any donation up to $50,000. So this is a really important time to be able to match funds, which we can then use to fund researchers here in Arizona, hopefully some in the area that Dr. Uma talked to you about today. So please answer the poll at the end. And again, I thank you for joining us, and I look forward to having you join us at the next webinar. Mitzi, thank you. Dr. Uma, thank you so much.
Thank you.
Thank you.